I was walking through the BruxZir department the other day and saw a articulator that was sitting here and noticed something on it that I wanted to make sure. I wanted to show you that we really pointed out to each other and wanted to make sure it was something that you yourself would look for or maybe your assistant would look for when you get a case back from us. So we've got a BruxZir bridge here going from tooth number 18 to tooth number 20 with a ponic here for tooth number 19. And one of the first things that our technicians noticed when they put the case together was that there was not quite enough room between number 20 and the opposing tooth. And because of the fact that this is a CAD/CAM product, well, actually nearly all of our products now, we take this model and we scan it. And so once this is poured, since this did not come in as a digital impression, it came as a polyvinyl impression. We pour it and then we scan it, and then we take the posing and we scan that, and then we scan the bite of the two together, and then the software tells us how much room we have. And in this case, we didn't have enough room according to the software, and then it was verified when we looked at it visually. So you'll notice there's a big sticker here that says adjust opposing marked in black, and it's also on the in-house lab sheet that we use as well, where it says adjust opposing mark in black. So everybody knows that when this ships, there has to be a sticker on the box with the BruxZir bridge in it that says adjust opposing marked in black. Now sometimes if it's on the preparation, it'll be a reduction coping. You've seen different reduction copings that we do. Some of them are thermoformed. My favorite ones are metal. Those are a little more expensive to fabricate. I can deal with the stiffer thermoformed ones. But in the case of something like that, we'll have a reduction coping that fits over this molar, and then typically there'll be a cutout, say on one cuss tip, where the cuss tip will be sticking out of the reduction coping, and we just want to take the burr back and forth and reduce that cuss tip down to the level of the reduction coping. I tend to do it with a football-shaped diamond, like a 379-023 diamond, named because it's shaped like a football. And the thing I like about the football is that because of the fact that it's convex, kind of like the surface of the Explorer here, when I hold this down against the tooth and cut through the reduction coping by reducing the cuss tip like we are over here, because of the shape of this, I actually get a little bonus reduction, if you will. Whereas you can imagine if I used a burr that was just a straight taper burr like this and held it to reduce this cuss tip down to the reduction coping, we would get enough reduction. But I like the fact that I get an extra tenth or two with a football fur because of the convexity that we see here. So again, you're just buying yourself just a little more space when you do that. And so anytime you receive something from us where you have the adjust opposing mark in black, without a reduction coping, it's usually just going to be something like this. And again, our technicians will do this with a straight tapered diamond. And I have talked to them many times, countless times, about, hey guys, this stone model, I know it's really easy to go in and adjust this, but guess what? In the patient's mouth, this is an actual tooth, this is actual enamel, this is precious tooth structure. We want to reduce as little as possible. And the best way to teach technicians this is to get them in the chair, and when you do a crown on them and then go to adjust their opposing and they reach out and grab your arm and say, no, in slow motion like in the movies, because they don't want their opposing, maybe it's a natural tooth ground on like this. It's a little different if it's a crown, or a little different if it's amalgam or something like that. So I caution them, please be very conservative when you come in and adjust this opposing dentition. So you can see that's a pretty small circle here. If you look at it, it's not like we have a huge flat spot that wasn't there before. It was just kind of pointy. In fact, when I do this on a patient, I don't say I'm going to go in and reduce your opposing. I say, you know what, the technician noticed when we scanned your case in the computer alerted us about a little sharp, what's called a cuss tip, a sharp point on the tooth there. And to make sure we don't break your new crown, I'm just going to go in and round that off a little bit, just kind of polish it a little bit so it's not as sharp against that new crown. And that always sounds better to me than saying, I'm going to take a coarse diamond football burr and at 40,000 RPMs, I'm going to come amputate part of the enamel here because I didn't take it out. So I just say I'm going to recontour that sharp point that the technician found or the computer found there. And again, rather than using a straight taper burr, for me, this is a good reason to use, again, a convex football burr to just go in and get a little bonus reduction as we go in and remove that little spot right in that area. We really don't need the use probably of a reduction coping here. It'd be difficult to do because the reduction coping wouldn't fit on here. Reduction copings fit well on preps because the interproximal contacts are broken. Here it wouldn't really go down, wouldn't really fit, but you can just eyeball this and just take a football diamond and spot it a couple times. You could use a fine grit diamond like a red stripe. You could even use something out of the BruxZir adjustment kit with the blue stripe on it and go in and because that's a very fine diamond and just hit it a few times and then it'd be very easy to polish afterwards. And of course, when you put the bridge in and had the patient bite together, you'd be able to identify with the articulating paper whether or not you had removed enough. So when we look at it now, you can kind of see that black spot that's there. And again, we have our minimum 0.6 of a millimeter reduction. That might be a little more. That could be 0.8, maybe up to a millimeter here. And again, we've talked about these BruxZir bridges before on this show. You know, this is, I would not fault any dentist who wanted to do a PFM bridge here. In fact, I would consider doing a PFM bridge here myself because it does go back to a second molar. In fact, I'll just come right out and say it. I would have done a PFM bridge here. I just don't think that having metal margins showing down here is that big of a deal, unless this was a patient who said, hey, no metal, I'm allergic to every metal found on the planet. I use plastic forks and spoons at home. That's how allergic to metal I am. In fact, don't touch me after you've touched that articulator. I will break out in hives. Unless they say something like that, I'm going to go with a PFM bridge here instead of a BruxZir bridge because there still is a chance this bridge can fracture. It's still an all ceramic restoration. That's really not even the point of what I wanted to show you of this. It was the impression itself. As we pull out a little bit and look at the impression, this is what we got from the doctor. So it's a full arch tray. That's nice. I like metal trays, but if I try to squeeze this plastic one, I'm squeezing pretty hard and I'm really not getting any movement. So it's a nice stiff tray, so we can't complain about that. But we can complain a little bit about the impression itself. We've got our one material that's been used here as kind of a pre-impression, and then we have the yellow that looks like it was done separately. You know, you've seen me many times go in and kind of peel this apart. You can always tell when looking at these impressions whether or not these two materials set at the same time. And it's something we've harped on before because it peels apart and it just never is as homogeneous as it would be if these two materials set at the same time. So we can be a little critical. This tore off actually when it was poured. If you look at the model on the lingual of that molar, you can see it is in fact actually here. So that thin little fin of material came off when it was poured. But you can see from the outside that we still have kind of a weak impression here because we don't have any of that tray material to the outside of this. But really the thing that caught my eye was the fact that there's nothing in between here. And so you can tell the pink material was taken first as an impression, and then after the preps, a little wash material was squirted on the two preps. But it was such little wash material that we really don't even pick up the ridge in between here. And that's kind of the bigger issue. Well, there's several issues here, but one of the issues is we don't have this yellow material contiguous between these two preps. And so as a result, when we make this BruxZir bridge, the bridge is going to be high and dry away from the tissue and could very easily pack a lot of food underneath it because we don't have a registration of what that ridge actually looks like. And that's one of the reasons why we're going to have to send this back to the doctor and ask for another impression because we're going to end up really high and dry here. But you can also see that without that material supporting it on the outside, it'd be pretty easy to get some sort of deformation here where it may not fit. I mean, technically, this is actually almost kind of outside of the tray itself when you look at this impression. But what would we have liked to see? Well, you probably know. You know as well as I do, we like that simultaneous impression where these both set at the same time. And I always will take this syringe material and squirt it around here and this prep and then in between it as well. If my assistant hasn't handed me the tray yet, I'll even start putting some on the incisal edges of the other teeth just to cover those as well. But even if you just squirted it here and here, even if you really didn't get any yellow here, but they set up together, you can just tell this wasn't in contact with the tissue because of these folds that you see here. So even if you had just done this little bit of yellow and then seated this tray all the way down against that ridge, These two materials would be indistinguishable from each other except for the color. And so when you see those together where it looks like it's all pink and then it just happens to be yellow here and it's all one impression, instead of what we have here where it looks like a dry lake bed with some more impression material on top of it, you can still get a successful restoration. So because of a lot of these factors, that's why we're going to need to ask for a new impression. It just reminded me of that show Chopped. I don't know if you guys watch that cooking show Chopped, but they'll always say, because of these factors, that's why we had to chop you. And so, yeah, this impression probably does need to be chopped. And I know the dentist can do a little bit better. I don't know if they were rushed, but you can see the void right along here as well. You know, over here, it actually turned out pretty good. We've got a nice impression around the buccolingual and occlusal surfaces of all those teeth. So with another chance to go in there and do that, hopefully we'll be able to capture this well. The dentist could even go ahead and could adjust that opposing tooth before the impression is taken, so we could deal with that now in the laboratory and not have to do that when the bridge is actually seated. So it just caught my eye as I walked by, and usually when you see a bridge impression, you will see the same colored material go from prep to prep. And when I saw this hole in the middle, I thought that's an interesting place to not have enough syringe material, and you really have to be trying to minimize, you know, how little syringe material you're going to use here, which is fine, again, in a simultaneous impression. But if you're going to do a two-step impression like this, we need a lot more. And frankly, you know, we'd like to see the rest of this maybe hollowed out a little bit with some more syringe material around there as well. So the preps themselves look really good. I've got no issues with the preps themselves. When we adjust that opposing, we'll get a little extra space for the BruxZir bridge over here, but a new impression will go a long way to making this case something that's going to be successful for the doctor and the patient as well.